Good afternoon, Dr. Andy Kirshner visiting you from the foot of beautiful Mount Masada in the Dead Sea Valley. My daughter Ella is working as the cameraman today. Because of some technical issues, we're actually using the iPhone as our camera, so the video quality is probably not what you're used to seeing here, but I hope you'll bear with me. I thought since I was here it would be a great place for me to present the next segment in my series on spinal surgery. Today I'd like to talk to you a little bit about disc replacement surgery. Now, disc replacement surgery is a relatively new procedure that's been around for a few years, and it is an alternative to the spinal fusion. Now, as we talked about in the last section, spinal fusion is when the disc is so damaged that they actually have to go in and use bits of bone or hardware to fuse two segments of the spine together to prevent them from moving. Now, the advantages of the disc replacement surgery are that you actually maintain flexibility at that segment. The disc isn't fused, it's actually replaced with a mechanical disc that allows movement. And it's a really cool procedure, but it does also have some drawbacks. Now, the first drawback is there are weight limitations for it. There are specific protocols for how much a patient can weigh, and it's based upon what level of the disc they're going to replace. Secondly, they don't work for everybody, and it's a pretty serious procedure, so when it doesn't work, it can be a little frustrating for the patient. And third of all, because it's relatively new, nobody's really sure how long the disc replacement lasts. Now, I've had a few patients who've had disc replacement surgeries, and they've worked pretty well. That being said, I've also had one or two that didn't go so well. They weren't any worse off than they were before the surgery, but the surgery didn't provide them any relief from the pain that they had in the first place. So now we've talked a little bit about spinal fusion, a little bit about the disc replacement surgery. In our next segment, we're going to talk about foraminotomies and a couple other procedures to help you find relief from back pain. As I said at the beginning of this series, spinal surgery is really a last resort procedure. Hopefully we try all the different conservative approaches first, and when all those have failed, that's when spinal surgery is a consideration. I'd like to thank you for joining me here from Israel. I hope you're having a great day, and I look forward to seeing you again at the Backwards blog. Thanks for joining me.